Hi, good morning. My name is Pam. I'm from the respiratory department. We're going to be doing this segment on trachea with Charity Love. First, I'm going to go over the equipment that would be needed for trachea, and I'll just throw in a couple for FYI information about some of the trachs that we're going to meet on the floors. You're going to gather chlorhexidine, peroxide. You're going to don your mask, gloves. These are disposable inner cannulas. On 6 Blum, you have a variety. In the ICU, you're going to get 6 and 8 in the supply scan room. You have your disposable trach tie. I'm going to open this up for you. Then you have your drain sponge dressing. It has a split. That's to go up under the trach. Okay. So now we're going to talk about the different types of trachs that we will be doing trachea on. This is the Shiley XLT. It has a disposable inner cannula. You're going to see this on the floor. This is stocked on 6 Blum, and we can also get it from the supply room or in Central. This is another type of trach. It's non-disposable, so we'll be cleaning this. When you're through, we put it back in, lock. These are the inner cannulas. These are disposable. We can take that out, throw it out, clean the area, get a new one, put it back in. These are, as I said, just examples of the different trachs that we have. These are Passimio valves. For speaking purposes, I'm just throwing this in. Thank you.
Hi, my name's Charity Love and I work here at Mount Sinai with the Education Department. As previously discussed, we're going to be showing you the process of proper trach care, which is performed every 24 hours on a patient. We have already talked about the supplies needed. I'm just going to briefly show you. We've already gathered our tracheostomy kit, our replacement inner cannula, our face mask with the eye shields, 4x4 gauzes, these split gauzes. We have our chlorhexidine wash, our hydrogen peroxide, as well as suction if needed. First, you're going to want to introduce yourself to the patient. Hello, Mr. Indiana Platinum. My name's Charity Love. I'm here to perform your trach care. What I'm going to be doing is cleaning around the area and replacing your inner cannula. Can you please verify your first and last name for me? He's going to verify for you, as well as your date of birth. Perfect. Now I'm going to walk you through the proper process, step by step, of how to adequately perform trach care. I've already identified that he has in a 6 French disposable inner cannula. So like I said, I've already gathered that supply from the supply room. All ICUs are stocked with both 6 and 8 French inner cannulas. 6 Blum is stocked with all the different possible inner cannulas you might be facing here at the hospital. If you do find one that you know is not stocked in the supply room, please call down to Central. Central will be able to send you one up. So first and foremost, I'm going to perform hand hygiene. And I'm going to don my regular exam gloves. Next, I'm going to place on my face mask with the shield.
Then you're going to assess the patient and determine if suction is needed before proceeding with tracheostomy care. Signs such as copious secretion, wheezing, increased respiratory rate, increased breathing, oxygen saturation.
So I've assessed the patient. There doesn't seem to be an increased amount of secretions. He's saturating well, 98%. I'm going to proceed. He does not apparently need to be suctioned at this moment.
Do not remove the face mask with the eye shield. Repeat hand hygiene. Open your tracheostomy kit. Maintain a sterile field. Pour equal amounts.
When you're preparing to perform trach care, make sure that you have the shiny side of this protective covering down towards the patient. This is going to help repel any water away from the patient. equal amounts. Sterile water.
Sterile water into the pit, into the inner removable container. Remove the the inner cannula, if he has one.
This is one that we will not be washing. This is one that we're going to be replacing. So we will not be performing cleansing to this inner cannula.
Don your exam gloves and remove the current gauze dressing. Assess the skin around the stoma for signs of breakdown and infection.
There does not appear to be any breakdown around the stoma or signs of infection.
Repeat hand hygiene and don sterile gloves again. Using a 4x4 gauze, moisten the CHD soap and water solution. Clean around the stoma, starting at 12 o'clock towards 3 o'clock.
You're going to want to, with the sterile gloves, use the 4x4 gauzes. You're going to dip them
Into your solution.
into the solution, which is half chlorhexidine, half sterile water, and you're going to start to wipe around the trach starting at 12. Continue from one end cleaning
3 o'clock,
mhm,
then 6 o'clock.
to 6 on one end. Dispose of that. New gauze, dipped in the solution. Clean on the other end. 12 o'clock
3.
and downward.
Mhm.
Dispose.
Rinse skin around the stoma with 4x4 gauze, which you already done. Pat and dry. Remove now the disposable inner cannula by gently unlocking it, touching only the external portion. Replace with a new one.
After I have washed with the chlorhexidine, I will take a new gauze, rinse it with the sterile water, pat it dry. Lastly, I'm going to take out the inner cannula. Very important, when you're removing the inner cannula, you're going to be holding on to this portion of the trach as you unclip. You're not going to be pulling unless you hold on to the flattened portion that is up against the neck. This will gently, slowly slide it out, and this will be disposed.
Replace with a new sterile disposable inner cannula by touching only the external portion and gently clipping or locking.
This is sterile inside.
You make sure it's
You
the right
want to
size.
make sure that the portion you only touch is going to be the outside portion. Do not touch along this. You will be simply grabbing it like this. Hold the flat portion against the skin and slowly maneuver this back into place, clipping. Make sure that you are able to tug while still holding the flat portion against the neck.
If the inner cannula is reusable, remove it with your contained hand and place it in the tray kit, if it's reusable.
This is an example of some reusable trachs you might encounter. It's very rarely that we see them here at the hospital, but if you do encounter one that is a twist and remove, this one needs to be cleaned as opposed to replaced. The proper process for cleaning is it will be cleaned with half hydrogen peroxide, half sterile water. And then you will simply, after cleaned, replace it, clip, ensure that the two blue dots are in line.
After you're through, apply pre-cut tracheostomy dressing under the tube flanges.
This is your split gauze that is made especially for trachs. This is going to be going up underneath. Carefully maneuver it around so that you can cover all portions as adequately as possible.
You can also change the tracheostomy ties when soiled. Attach new ties before removing the soiled or the old one, which we did. Document disposable or reusable type of trach that the patient has upon admission or initial surgery. You document your performance of tracheostomy care on the patient's medical record at the end of the procedure. Follow position order for postoperative care. Notify the physician if any sutures has not been removed after 72 hours from initial surgery. Follow tracheostomy care as the following.
Make sure that tracheostomy care is performed every 24 hours. If you are in the ICU, the nurse that cares for the patient will be performing this care. If you are in a unit that is not the ICU, the respiratory therapist will be the licensed personnel responsible for performing this care. This care is documented as stated in the flow sheet where the LDA for surgical airway has been inserted under complex assessment. Ensure that you document in each of these columns the care that was provided, as well as the exchange or cleaning of the inner cannula and the date that this was performed. Thank you very much. Have a nice day.
Thank you.